Hello, I'm Dr. Omar.
And I'm Dr. Nicola. Seriously.
And welcome to the new ENT Basics video. Truth be told, we very nearly didn't make this video, because after the storm and success of our first 5, frankly, the pressures of celebrity became far too much.
No photos! No photos!
But, as Shakespeare probably said, the only way to fight success is with success.
Oh, nice.
So welcome to the latest short, sharp, scratch production, Infections of the Ear.
The pinna of the ear leads into the ear canal through the external auditory meatus. This comprises the outer ear. The outer ear ends at the end of the ear canal at the tympanic membrane. Behind the tympanic membrane is the middle ear, which consists of the auditory ossicles and leads into the eustachian tube. The middle ear ends at the oval window of the cochlea, and behind the middle ear is the inner ear, which comprises of the semicircular canals and cochlea. To better demonstrate the anatomy of the ear with its ear canal, why better to come to than Birmingham's famous canals?
Ear infections can be grouped into 2 broad categories: otitis externa, which affects the outer ear and notably the ear canal, and otitis media, which affects the middle ear behind the tympanic membrane.
Otitis externa is often caused by trauma to the ear canal, giving rise to the name post-traumatic stress disorder.
Common causes of trauma to the ear canal are scratching one's ear or using cotton buds, as I will demonstrate now. Once trauma to the canal has been sustained, the ear canal is susceptible to bacterial infections or fungal infections. For this reason, infections of the ear must be treated with topical antibiotics in the form of ear drops, although in severe cases, oral antibiotics may be used, and in very severe cases, euthanasia.
Sometimes in otitis externa, the ear canal becomes so edematous and narrowed that treating with topical antibiotics is ineffective, as they are not able to penetrate the ear canal deeply enough to treat the infection, in which case you need to refer to the ENT team either for microsuction or insertion of a wick gauze. Where does the simple goose go when it has an ear infection? Food for thought.
We will now move on to otitis media, which is a very common complaint in children. It is often said that children should be seen and not heard, but the tragedy in otitis media is that children can be seen but are not able to hear.
Otitis media is caused by a viral or bacterial upper respiratory tract infection, which causes swelling and eventually closure of the eustachian tube. This leads to the accumulation of fluid in the middle ear, which leads to pain and hearing loss.
What's the most common symptom of ear infection? Pus from the oral cavity is not one of them because the eustachian tube is swollen up.
The majority of otitis media will be viral in origin and therefore should be treated conservatively. However, otitis media that persists beyond 3 days, you should consider the use of antibiotics such as amoxicillin or erythromycin.
There are some important sequelae of otitis media that one should know about. The first and perhaps the most common is perforation of the eardrum, which will usually heal itself within 6 weeks' time. The second is chronic otitis media with effusion, also known as glue ear. This is a chronic buildup of fluid behind the middle ear, which becomes extremely sticky and needs to be drained in theatre to avoid problems with hearing. Grommets are often also inserted to aid the continuing discharge of fluid from the middle ear. Chronic suppurative otitis media is a chronically discharging ear through a hole in the tympanic membrane. The final sequela, and certainly the most important, is mastoiditis, which is a spread of otitis media to the mastoid cavity. This is an extremely serious condition which makes patients very unwell and requires urgent referral to the ENT specialist for urgent drainage in theatre. Of course, course, in this modern world of choice and plenty, we all have our own favourite ear infection. Nicola is particularly fond of glue ear.
Yes, and Omar has a penchant for diarrhea.
Though we've covered the pathophysiology behind otitis media and otitis externa, it's important to know both how they present and how to differentiate between the two.
Ow! What?
When a patient walks into the A&E clinic, or in some cases rolls in on their side, you may notice that their symptoms are quite non-specific. They may be suffering from pyrexia, from pain,
Ow!
from hearing loss,
What?
itchiness, or in the case of children too thick to know where their problem's coming from, tugging at their ear or general parts of their body. Initially on examination, one should first inspect the outer ear, looking for any signs of erythema or swelling. One should also look for any discharge from the ear, referred to as otorrhea. Palpate across the pinna and notably the tragus.
On a person whose ear isn't infected, tapping the tragus should not elicit pain.
These are both signs of otitis externa. One should also look for signs of possible mastoiditis.
Look at the external ear from behind to make sure that there isn't loss of the sulcus, and palpate to check there isn't bogginess around the mastoid or external ear area.
It is good practice to perform a hearing test, as a conductive hearing loss picture is much more indicative of otitis media, and if there is any sign of sensory neural hearing loss that wasn't previously present,
What?
the patient will have to go for formal hearing tests. The mainstay of any ear exam, however, is otoscopy. If the otoscopic examination is not well tolerated, it suggests a possible trauma or otitis externa in the ear canal. On examining the ear canal, one should look for any swelling, any signs of discharge, or any signs of trauma, or the general redness of inflammation. On the tympanic membrane, one should look for erythema, for swelling or retraction, which both can be signs of otitis media, and one may see a dullness or a decrease in the normal light reflex. Using otoscopy, one can also find things such as perforation of the eardrum, and rarer things which we will not discuss in this video. Having covered the basics of otitis externa and otitis media, we will quickly recap the differences between the two.
The B, the E, the A, the G.
Omar, what did you think of the video?
That's right. Ain't all my people say. That's all right. Ain't all my people say. Can we go back? This is the moment. Tonight is the night. We'll fight till it's over. So we brought our hands up like the ceiling can't hold us.
Hello.
I start.
You know, no, you don't. I do it.
I start.
And then you say it.
I say it.
Oh, yeah. Okay,
Yeah.
go on.
Like the ceiling can't hold us.